Hello, and welcome to the podcast series. In this edition, we discuss burns and burn prevention in children. And joining us today is Dr. Tome Mendes, a general surgeon and consultant in burns and burn prevention. Uh, Dr. Mendes, welcome
Good morning.
and thank you for joining us.
Yeah, thanks for having me and giving us the opportunity to discuss this topic.
You're very welcome. So, I think let's kick off by saying that the burns among children fall among the top 5 of preventable injuries. Looking at, drawing on your experience, can you tell us a little bit about that? How serious is the burns issue for children?
Yeah, so burns is one of the leading causes of injury and unfortunately of mortality or of death, amongst children in South Africa. And studies vary, but it's in the top 5, as you mentioned, of causes of injury and causes of death. It's also very high up, and it's something that's relatively under-resourced in many parts of the country. We're fortunate here, at Red Cross, and that we have a dedicated burns unit just for pediatrics. But in many centres around the country or on the continent, burns is managed in between other trauma, and without a dedicated service, you often struggle to manage these patients. In terms of sort of just roughly numbers that we see, just in our outpatient service, we see close to 5,000 consults a year, and that's just the burns outpatient service. And in the ward, we have so in the hundreds of admissions throughout the year. So the burden is quite significant. And I think what's important or unique about burns is that it's not something that heals quickly, and it's something that has a significant impact for someone with a severe burn, at least. And it really requires a dedicated team and an approach to it. And more importantly, what's I think in a way frustrating or about burns is that a lot of the times it's preventable.
Yeah.
So it's a preventable injury that has a very significant sort of impact on the patient.
Yeah. So many of the understanding burns, everybody understands a burn is a burn, but
Yeah.
there's so much more to a burn, and different kinds of burns.
Yeah.
Would you be able to just walk us through maybe some of the different types of burns that you've seen?
Yeah. So the burns you can broadly describe in 2 different groups. The first is how is the burn caused, and the groups that we look at there is you can either be burned from a flame, an open flame, or hot coals. So to describe as a flame burn, and then the biggest group in children is actually a hot water or a hot liquid burn. So whether it's hot water from a tap, whether it's a cup of coffee, boiling water on the stove, and that actually forms the biggest proportion of burns that we see in the pediatric environment. And that accounts for about 80% of the admissions we see are liquid burns, so either water or some other hot liquid. In adults, it's a lot less in terms of the proportion, but it's our biggest group in pediatrics. And then you get the other slightly rarer but still significant burns, which would be your electrical burns, sort of touching an open socket or high voltage wire. And although that's less common, it's quite a significant burn as well. And then the chemical burns we see less frequently, but it still does come a few times throughout the year. And then the last group, which sort of falls under the burns category, is the inhalational burns, so smoke inhalation, or someone that's in a house and there's a lot of smoke that they've inhaled, or hot air. That's a separate group, but they don't end up with wounds, so we don't often see them in our unit, but it is this still falls under the type of burn
Burn.
categories that you do.
When we look at treating burns, and maybe we should start with understanding the difference between a first degree burn
Yeah.
and a third degree burn. What does that actually mean?
Yeah, so that's the sort of second descriptor of burns that we use, which is looking at the significance or essentially the depth of the burn. Traditionally, it was always referred to as sort of first, second, third degree burn. So you still see that out in a lot of the literature and a lot of the discussions or shows that that you'll see in burns will mention that. And there's new naming for it, which I'll just briefly describe now. But essentially what you're looking at is, if you were to look at the skin in a cross section from the outer surface inwards and the different layers of the skin, that aims to describe how far down the different layers of the skin the burn has gone. First degree we now refer to as a superficial, it's just superficial burn, and that's just your top layer. And the most mild version of that is a bad sunburn, where your skin goes red, but there's no blistering, there's no wounds, but it's sore, or you just had some hot water on your hand, but it doesn't form a wound, but you can feel pain, and it's red and it's a bit irritated. So that's grouped into superficial. Then you look at the intermediate thickness burns or partial thickness burns, which has then gone one further layer down, so into your what we call the dermis of the skin, and that's divided into two, either superficial or deep partial thickness. So I think people prefer first, second, third degree burns because it's easier. That's less in terms of naming. But that would be your secondary degree burn, which is your second layer of the skin. And there you start to develop a wound, so you'll have some blistering, or there's a wound which opens that can be extremely painful if it's superficial. And as it gets deeper, actually it becomes less painful, which is because of the damage of the burn, you get less sensation on the burn wound. So your deep partial thickness burn is a deeper burn, but it's less painful to the patient. And it doesn't look as healthy. It looks like there's less blood flow, and that's because it's a deeper burn. And then your third degree burn describes what's now termed a full thickness burn. So that's where it's gone through your outer layer epidermis, your dermis, and it's down to the sort of fatty layer that sits under your skin. And that means all of your skin in that area has been burned through. And then there was a fourth degree, which is then through to even deeper structures like your bone or connective tissue, and that's obviously that's a very significant burn. So we know that in adults, a lot of the burns are that if you burn yourself with hot water, it will be a superficial burn.
Yeah.
What makes it interesting in children is their skin's a lot thinner, it's much more fragile. So if they have a hot water splash, the chance of it going through that first layer into the second layer or deeper is much higher. So that's why we see a lot of significant hot water burns or liquid burns in children, because it goes through the layers a lot quicker, or the heat transfers a lot quicker. And obviously the deeper the burn goes, it goes out saying it's more significant. You're healing. A sunburn or something superficial will generally heal with dressings, and as it goes lower, you end up needing more operations or potentially a skin graft or something to actually allow that area to heal.
It's quite interesting that you've mentioned, because children's skin are thinner and much more susceptible to serious injury. It's also one of the reasons why ChildSafe advocates for putting cold water in the bath first before adding the hot water, for exactly that reason. And so when we look at some of the treatment of those various types of burns, how are they treated differently and why?
So I think just as a general principle, the main thing you want to do if you have a burn wound is that child's been exposed to a significant heat that is causing an injury. The heat is what causes the burn or the injury. And your first thing in terms of treating it at first aid is you want to reduce the amount of heat on that wound. And what that aims to do is prevent that heat from spreading deeper or from making a larger wound than the initial burn. There are many ways of doing it. There's some commercial products such as these gels that you can put on. I mean, it's a well-known name, but the burn shields and similar products that aim to initially cool the wound down. But we know that many people don't have that lying around at home and ready to go. So the first line that we recommend is still just cold running water. And you want to do that for a good few minutes, and the aim is you want to reduce the heat on that burn wound. So you really want to cool that down as much as possible, as early as you can. If you wait an hour to do it, then you're not getting that benefit. So what we always say is, as it happens, your first response should be to aim to cool the wound down. And the best thing we find is just water, just clean water. If it's running, that's preferable. But even if it's still cold water, if you don't have sort of a running tap at home, or there are options just to cool the wound down.
Is there any specific reason why you would be burned in a specific locality? Why does that area keep heating up? What happens in the body that causes that heat generation?
So it's more the
Is it like an inflammation?
Yes. So the water or the flame or whatever has caused the burn. It heats up your skin or your tissue to the point of causing damage.
Right.
And now you've got that area of the body that's been warmed up to the point of causing damage, starts to, that heat then spreads to surrounding tissues because it's there. Later on, you do get a reaction to the burn in terms of inflammation and that, but the initial sort of heat is just from the initial injury, and then that heat sort of dissipating to surrounding tissues, trying to, almost to dissipate the heat. It tends to sit there on the wound and spread until it gets cooled down. But that's where the first aid comes in terms of your first step in first aid is cool down the area as much as you can. We tend to say don't, jump straight for ice. That's why we prefer running water. It's more comfortable for the patients than going for ice, because that's a bit of an extreme that can be quite uncomfortable. But just sort of cold or sort of tap water is we find the best thing. It just helps to get rid of that heat. If it's a hot summer's day and you're feeling overheated, the first thing you want to do is either get in a pool or cool yourself down. It's a similar principle. Water just helps to cool down the wounds.
Right. So when we need to give advice to parents that may have encountered an unfortunate incident, it's obviously a very painful experience. What can we do to alleviate and mitigate that pain? And what should parents never do that could impede the medium or long-term outcomes of the patient?
Yeah. So I think, burns is an unfortunate thing in that it is a very uncomfortable and painful thing for the patients. And, as much as we try to reduce that pain and the trauma experienced by the child, there's a degree of trauma that you'll just never get away from as burns because of the pain. The cooling effect does have a sort of therapeutic, and it helps to ease the discomfort from the burn. We advocate to parents, if you have just Panado, some simple painkillers at home that are, allocated for your child, don't start going to your cabinet and taking any painkillers that you take and give them. So, anything that, is safe for a child in terms of painkillers you have at home, you can give them that. And then the big thing is, try as much as you can to comfort the child. Try to relax the situation. The child's stressed. As a parent or as a caregiver, you're going to be stressed. But if you can just try convey some calm and help the child through the process that is traumatic. Then cooling down the burns helps significantly. Some of the burn dressings, the first aid dressings, help a bit with the pain as well. And then
But
know,
there are certain dressings that should be used and certain that should
yeah,
not be
and
used.
then what you don't want to do is put anything on that will make it worse.
Wow.
So unfortunately, there are a lot of sort of myths and stories that are out there about burns, and if you have a burn, you should do X, Y, Z. And some of the ones that are out there actually cause more discomfort and actually make the process worse and actually prevent the first aid from working adequately. So common ones that are out there is putting butter on a wound, or oil, or sunflower oil, or sunlight liquid, or toothpaste, and there's all these theories that are out there, but the reality is most of them don't help, and a lot of them actually make things worse. And when the child comes to hospital, now you've got a hot water burn that was just a hot water burn initially, and now there's a second thing on it. And I mentioned earlier, chemical burns is a whole different kind of burn. So if you've got broken skin and you put something on there that's now harmful, you end up adding a second burn to the patient. So we really ask that people avoid putting anything that isn't designed for burns on a burn wound, and just sticking to sometimes the most simple thing is the best.
Yeah.
And we know that hot water burns, that cold water is
The best option.
Is the best, and the safest.
So some of these substances that people may put up can obviously also increase the risk of infection, which is very dangerous for burn patients. In debunking some of those myths, how does doctors treat burns? And I think maybe from this perspective of parents, they don't always get to see what's happening behind the scenes. It is traumatic, it's stressful for them. What comfort can we give the parents, in that treatment process generically?
So I think what's important to mention is that a burn wound, or someone that's been burned, the healing process takes time. So we know that in a lot of the hot water burns, for example, we give them at least 3 weeks to heal on their own, or to tell us how. Sometimes your initial guess of how deep the wound is or how bad the burn is isn't always 100% right, and over the time you see it sort of develop and tell you which way it's going. But burns take time to heal. So I think for parents it's to be aware that if your child has sustained a significant burn, the healing process is going to be, it's not hours to days, it's more sort of days to weeks, and even potentially months in the more severe burns. What we aim to do is to promote that healing process. And there's basic things we do. We try to keep infection off of the wounds. We try to keep the children as well fed and sort of strong enough to handle the healing process in terms of nourishment or extra feeds. And we, once they're in hospital, we end up using sort of specialized dressings, or once they're attending a burn service, rather, let me say, because a lot of our patients are outpatients, which we see once or twice a week. And then we aim to manage the pain and the comfort as much as possible. And we know that burns patients, pain is one big group, and that's an issue that has to be addressed. And that we use just simple painkillers, and sometimes we have access to additional painkillers in the bigger burns. And then itching is another thing that sometimes catches patients or parents unawares, is that burn wounds, as they start to heal, and sometimes from the dressings, itching becomes one of the biggest complaints. And that's a normal thing, it's an expected thing. And if they're experiencing that, there's medication to help reduce that. There's different dressings we can try. And I think for the parents, the biggest thing is to remain sort of involved in or caregiver, to remain involved in the care of the patient throughout that whole process,
Mm.
and to actively engage with the treating teams. If you have issues or concerns, you must bring them up with your when you're attending for dressings, and generally, that gives us the chance to engage and see where we can help things. Yeah, I think it's just to understand that it's a long haul with
process,
especially with the more major burns.
So, at what point would one become concerned about scarring, and how can you minimize the scarring process?
So, scarring is a major point, and I think when you mention burns to someone, the first thing that comes to the mind is, oh, my child's going to have these scars, and how they're going to function, and it's a scary concept if your child's had a major burn. What we know is that the more superficial burns tend to heal without scarring, and they often, in many years' time, you can't even see that there was a burn in that area. Where scarring becomes a concern is the deeper burns, and where it's over a major joint, or like a finger joint or somewhere where the scar is actually going to change the way your body functions or your hand functions. And obviously the facial scars are always quite concerning for families. The best way of preventing, or I'd rather say reducing scarring, because you have to accept there will be some degree of scarring, is by good wound care is the first step, preventing infection, all the things I mentioned earlier. If your child is needing regular dressings, you have to attend regularly. They have to be checked for infection and have their dressings changed to make sure that there's no regression or infection on the wounds. And when we can see that it's a deeper burn that is going to leave a significant scar, or if it's over a joint, that's when we tend to start recommending an operation. So if we know that the wound won't heal, or that it will heal but with very bad scarring, we then start looking at the operative options, and what most of our burns are dressed with is a skin graft. And although that leaves a scar, it's a better scar than what would have happened if you just left it to heal on its own. So I think parents often get a fright when you say, we think your child needs an operation, and now they're worried that he's going to get a scar, it's going to be disfigured from the operation. And it's one of the things that we have to address, is the operation is there to prevent or reduce the scarring and the damage, and to improve function. So it's not always a sign that things are getting worse, it's just a sign that the significance of the burn is actually quite major.
Yeah.
So I think parents are often nervous when we first say, and obviously everyone wants to avoid an operation. It's natural, but it's one of our biggest tools in terms of preventing scarring. And then the other big arm that we use in scar management is our rehabilitation team. So at Red Cross, we're quite fortunate that we have a very dedicated occupational therapy and physiotherapy department, and they are actively involved in scar management. And one of the biggest ways to prevent or reduce scarring is to use the joints. And if you have a hand burn and you don't use it, it will be scarred in a certain position. And they're incredible at getting our patients to start moving their hands early, and we know that that helps to prevent permanent scarring. And then in the long-term therapy, they have certain techniques and that they use to reduce the effect of scarring or the harshness of a scar on the child. And then the delayed thing that we use for scar management is a lot of work with the plastic surgery team, and they have different modalities such as laser therapy, or sometimes a delayed operation to help reduce or release the effect of the scar tissue, if that makes sense. So it's a major topic, the scarring and burns, and it really needs a very broad and very skilled team to reduce the impact. I think where parents can play a part is, if you've been given a set of exercises or splints or something to use by the therapy team, you really have to actively engage and keep the exercises going, and attending your follow-ups, and sort of that's the parent role in terms of making sure that they can do as much as possible to prevent permanent damage from the burns.
Yeah. So before we move on to more preventative measures to prevent burns altogether, there was an interesting observation, perhaps a controversial one, but why more boys than girls?
Yeah, it's always an interesting one, and there'll be a few theories around it, but we generally see burns happening as children start to either become more active and curious, or they start getting up to some more mischief. And we have certain waves in ages where we know that major burns happen. As a child starts to crawl around, they're starting to grab at things, or as they're starting to walk and climb, and suddenly they can reach the countertops and they're curious. And then later on, the maybe more adventurous or sort of risk-taking behaviors, playing with matches, or they have an older friend that's smoking, and they, whatever it is, maybe that's where the boys getting burned more than girls comes in. That there tends to be a pattern of boys being slightly more risk-taking. We see that in the trauma unit in terms of fractures and this and that. And as the kids start to take more chances or push the boundaries a bit more, their risk of injury goes up, and unfortunately burns is one of those injuries.
Do you think
I don't have the numbers to prove it.
I don't know, but I think it makes for an interesting discussion, because sometimes parents will say, he's a boy, walk it off, kind of thing.
Yeah.
Do you think that also may have an influence? That is that it, or that
Sure,
I don't want to put the blame at the parents' door, but to raise awareness that even though it's a boy, and even though it might be a perception that boys are tougher than girls, it doesn't necessarily mean that they don't need the same support and oversight.
Exactly. I think it tends to happen if a boy's rolling around in the mud, people maybe are less inclined to go and say, hey, listen, you're going to get dirty, come back inside. As there might be there's a tendency to be more protective of a female child, of a girl child. Maybe they're more willing to let boys sort of wander around and explore a bit, and whether that's right or wrong is a different thing. But I do think a lot of it comes to that sort of risk-taking behaviors that, especially in the adolescent boys, or so as they get a bit older, is where we start to see more boys getting injured than girls. Whereas in the earlier age groups, I think it's more matched. The toddlers that are crawling, and they're just grabbing at whatever they can, and they're putting themselves at risk of injury. But I think later on, the electrical burns and the flame burns are often from wandering or touching stuff that you shouldn't. Or playing with matches or something like that.
Which then I think leads us into the prevention. How to ChildSafe or burn safe your environment to prevent burns in the first place.
So I think the first step is being aware of when are the high risk sort of age groups where as your child goes through different life stages, and I think it's actually on one of ChildSafe's promotional materials in terms of the different injuries you see at different age groups. And I think that's important to recognize that when your child starts crawling, you need to modify your home. When your child's walking a bit more and able to climb up things, you need to make adjustments to the house in keeping with your child's sort of life stage. There's just looking around the room here, and there's a lot of initiatives that I know ChildSafe has been driving in terms of how to actually child-proof your home for the different life stages. You've got the sort of the safety candle. We rather than just having an open candle that can be knocked over, you put it inside of a glass jar with a sand at the bottom. There's things like not, as far as possible, not cooking low down where a child can reach the stove and trying to elevate the stove or the hot water above the child's reach. And cords and kettles are a dangerous thing, so you can have to have your kettle secure. You can't have anything that the child can grab. And I think it's just a relentless sort of caution around the house that and it's always unfortunate, you can be watching your child the whole day and then you turn around for 5 seconds and that's when they reach for that cup of coffee that you've just finished making, and it's hard, but it's just being aware around the house and reducing your risk as far as possible. And I mean, I didn't mention it earlier, but it's really hard in South Africa to make a home child safe. I think a lot of it's relatively hard compared to a lot of places overseas. A lot of the burns we see, unfortunately, are very linked to sort of home circumstance or socioeconomic status. If you have an informal house where it's already overcrowded and you've got high density in the house, and then you have to collect water outside, heat it on a fire, bring it into the bath. All these extra steps really make it quite a unique challenge in South Africa to address. And a large portion of our burns are related to sort of tougher socioeconomic status. And that's where you really need unique interventions that are affordable and implementable at an environment that isn't your standard kitchen counter that's almost a meter high when people are cooking down on crates or something like that. And that's a very hard challenge. But I think it's just an awareness of how burns happen. We're not the high risk age groups, and I know you mentioned it earlier. Put your cold water in first, and then add the hot water. Test the temperature before you put a child in a bath, and
never leave children out.
And just you cannot leave them alone. And if they do have to, they have to be in the care of someone who's responsible. And I think there will always be there will always be burns that happen regardless of how careful someone is. It's something that accidents do happen. I think you just want to try to as much as possible to know that you've taken steps to prevent it, so that we often have parents feeling quite guilty that I should have done that. And it's a hard thing. You don't want to go down that rabbit hole. Sure. But I think as a parent, you just want to know that you've done as much to keep your child safe as possible. It could be ideal if there were no burns, but that's unlikely to be a reality.
But at least something we can work towards.
Reducing these preventable burns is that group of burns where you really want to address.
Well, Dr. Mendes brings us to the end of today's edition on burns and burn prevention. Thank you very much for your time and your insight, and also for the life-changing and life-saving work that you do every day. And to our viewers, if you have enjoyed the content of this podcast and would like to see more of it, please subscribe, follow, like, and share so that others may also benefit from the insights you gained here today. Until next time, take care